Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning and welcome to Facing South Florida. As we are well aware, Florida is in the midst of a coronavirus surge, with tens of thousands of new cases in the past week alone. On one level, elected officials are trying to downplay the threat, clinging to the most favorable statistics they can find. Listen to Miami-Dade Mayor Carlos Jimenez explain how there is no hospital crisis because there are plenty of available beds for patients across the county.
Now, before wrapping up, I want to talk a little bit about the uptick in hospitalizations. We still have plenty of acute care and ICU beds, but there are some hospitals that have transferred their patients to other hospitals in their healthcare systems. The capacity overall in Miami-Dade County is very good and pretty stable. The number of COVID patients in our hospital is still considerably less than what we saw during the height of the pandemic. We also have a temporary hospital built by the Army Corps of Engineers at the Miami Beach Convention Center for any overflow. And there's plenty of ICU beds still available.
Here is the problem with what he is saying. The issue is not how many beds do we have. The issue is a lack of doctors and nurses to properly staff the patients who may end up in those beds. Doctors and nurses have been working without a break for months and are now seeing a spike in COVID patients. This week, I spoke to Martha Baker, who represents more than 5,000 doctors and nurses and healthcare workers at Jackson Health System. Listen carefully to what she says, and you will understand the real problem.
We're just seeing the peak of COVID is going up, and the number of nurses is not. And as a matter of fact, we have more employees with COVID and out. You know, our rapid response team has 2 and possibly a third one waiting on the result. Our transplant unit had 3 nurses convert to COVID. Purdue Medical Center had 15 employees convert to COVID. This is all like this last week.
I just want to understand the terminology. When you say convert to COVID,
Meaning
are you
positive.
saying meaning they're testing positive?
Yes.
So how many total nurses are
I don't know.
Positive, would you guess?
I don't, well, all I know is this week it's probably been 3, 6, 21 in just the last 3 days of meetings. Anecdotally, 21 nurses and caregivers are positive.
Within Jackson?
Within like 3 units, yeah. So it's not, and I just think, you know, you take Purdue Medical Center, for example, it's a nursing home. It's not the patients that are giving it to them. The patients are negative. It's people in this community being open back up are running into COVID and they don't either know it or they don't believe it or they're not convinced they're at risk. And they can all be asymptomatic even, right? You're still able to give it to a patient. So it's of concern that we're running up against COVID climbing at a time when we've opened back up in society, right? Dade County's kind of opened back up. Our trend is peaking way beyond what Italy was doing at their worst. And our patients within our hospital at Jackson Memorial are climbing. Jackson North and South are like at capacity and their numbers are increasing. We don't have the wiggle room. And my plea today to Mr. Magoya was to please balance the capacity with your staffing availability. And, you know, you've got to figure out a way anticipating that tomorrow and next week are going to be worse than today, according to the trend line. And that worries me.
Well, one of the big steps that the hospital took was in the early days, they canceled all elective surgeries so that there would be the bed space, the nurses, all of those sorts of things. And then a few weeks ago, maybe a month or so ago, when they started trying to open everything back up, they reinstituted elective surgeries. They were bringing people in for non-critical surgeries to have it taken care of. Have you requested that they stop doing elective surgeries to bring those numbers back down? They used to have like 60%, you know, with 40% available beds. 60s. Now you're saying they're at 85% and climbing.
Yeah. Yeah. The first go round, because of elective surgeries canceling statewide, we were able to be, 60, 65, 70, 75% capacity. And that gave us what I call elbow room to take care of the COVIDs, all the donning and doffing, and isolate the sick patients. And now when we've let electives come back, which is every hospital's, depends on elective surgeries to stay financially, above water. But you have to balance that with this health risk of COVID. And, unfortunately, COVID is, those who have succeeded, like New York City and Governor Cuomo, they actually ignored kind of the financial side of it to manage the health side of it. And while we've tried to open up, our COVIDs have begun to peak in Florida, at Jackson, wherever. And it's every hospital in South Florida, COVIDs are climbing. And it's a concern that we're back to 85% capacity. Today at Jackson, we had 1 ICU bed available, 1. The first phase, when we were running with some elbow room at 60 to 75% capacity, if you came in the ER and you need an ICU bed, you could go upstairs pretty quickly. That's ideal. When you have to wait, 10, 12, 20, 30 hours in the ER to go upstairs, that puts a burden not only on the patient and their health, but on the staff in the ED. And they're now taking care of inpatient and ER patients. It's just not ideal. And if they're COVID, they're infecting others. If, hopefully not, but the possibility is there. We need to move patients efficiently, and it's going to it's not about today. I mean, 85% capacity at Jackson, where Jackson North and South their volumes are up higher than they've been in the last 6 months, and the COVIDs are up.
Well, let's talk about nursing and the staffing issues that you have there. So, obviously Jackson geared up starting in March. So you, in that April, May timeframe, you were ready, you were trying to make sure that you could flatten the curve, you had staff available, all those sorts of things in place, which means your nurses were still operating under intense conditions for a period of time there. Now we're actually seeing the worst of it. So talk to me about the state of mind of the nurses there. Are they tired? Are they run down? Are they exhausted? I mean, run at this sort of level for months, for weeks at a time, months at a time, has to be debilitating for them.
Right. And because we needed them to staff the units, they had their vacation time. If they had requested vacation time in advance, that was canceled. They weren't allowed to take time off. They had to keep working. And so they were looking for a reprieve, obviously. And, phase 2 or whatever we want to call it came much faster than anybody expected. They're tired. They need time off. They need more nurses. And now we have more COVIDs than ever.
Well, what is the staff? Let's talk about the staffing level. So, how many nurses would you typically have per COVID patient?
Well, for an ICU, it's, the typical 1-to-1, 1-to-2 ratio. One nurse has either one patient if they're extremely sick, which the MICU has 8 COVIDs in one of their units, and 4 of them are one-on-one. And sometimes that gets stretched and they all have to take 2 patients. And that's unfortunate. That's when patients don't get turned. That's when patients don't get the care they deserve. That's when the nurse doesn't get to go to lunch. That's tight. That's hard times right there. And you hope that doesn't, fall but once in a while, but, it's happened all too frequently. And we just got off the phone with our chief nurse, and I think she's going to try and fix it. But, nurses are emptying trash cans because housekeeping doesn't want to come into a room that's got a COVID patient. I mean, nurses are doing unbelievable things. Charge nurses are taking patients when they're normally supposed to be free so they can help you. It's tight.
Do you feel comfortable sharing the story you were sharing with me about one of the nurses, what they said, an anecdote that they relayed to you just recently?
Which one was that?
the nurse who was taking care of 2 patients who both passed away.
Yeah. There was one ICU nurse that in the MICU, and as a matter of fact, he shared that story with the chief nurse. I believe these 2 patients sounded like they were so sick they were most likely not going to make it. They were extreme COVID positive patients with what you call proning, where they turn them on their belly so their lungs ventilate better. They're on breathing machines, they're on vasoactive drips and CVVHD and ECMO and all these, very, very, very labor intensive maneuvers to try and save their lives. And both patients ended up dying on the same shift. And this nurse couldn't be with both patients, obviously.
These are the type of patients that you would have typically. You would want to have one-on-one, one nurse per one patient. Instead, this nurse had both patients, and not through any fault of the nurses, and maybe the outcome would have been the same. But that's got to be devastating for that nurse to sort of in the same shift have two patients that you're trying to share time with end up dying on you.
Yeah. Well,
what's the emotional toll like that on a nurse?
It's interesting because my vice president, Vicky Gonzalez, was reading off a white paper across this country. They're publishing that, a patient gets a bed sore and a nurse feels horrible because that's preventable. You don't want them to have anything untoward happen, let alone anything that's preventable to happen. I don't believe that how sick these patients were, that perhaps death was imminent. But it's a horrible toll to know that they should have been singled and they were doubled. And your charge
should have
nurse
had one-on-one nursing. Instead, they had one nurse for two patients.
Yeah, and you should have a charge nurse free at all times, and to help with those emergency situations. And too often the charge nurses are taking patients, and that's 15% of the charge nurses today at Jackson have patients. And again, we're at 85% capacity. So my biggest concern is not necessarily today. We're tight today. We've got 15% of our units are so tight staffed that the charge nurse has patients, and still, we think tomorrow will be worse. We think next week will be worse. This trend in patients in COVID patients and in our volumes at our hospitals is just going up. So it's of concern. I think we have to manage it. I'm not recommending we have to shut it down and cancel electives, but we do have to manage it and be very aware of our nursing capacity and our hospital capacity. And it's not just have an open bed, we'll have a patient in it. We've got to manage it with our staffing, especially in recognition that our nurses are going into, second battle, and we're limping.
That's not something that's easy for you to admit. You're right. I mean, this is you. I know I've known you for a long time, Martha, and your nurses tend to soldier through almost anything. For you to admit that they're hurting and they're limping through this, that's a big statement coming from you.
Yeah, I was quite shocked at our meeting with many staff nurses yesterday, what I heard. And I'm not trying to bash Jackson. I love Jackson. I was a nurse there for 35 years. Proud to be president of these nurses and doctors and healthcare professionals that work so hard. I think they're the best, not only in Florida, but in the country. But we cannot have elected leaders saying it's okay to open up and put the health of our community members at stake. And we have always said from the inside of Jackson, if we ever see it looks dangerous, we will speak up. And that's what we're doing now.
So now we've been warned. Elected officials can't plead ignorance. So what will the mayor, the governor, and hospital bureaucrats do next? We'll be watching. When we come back, Melba Pearson, a candidate for Miami-Dade State Attorney.